So I'm delighted to welcome everybody here for our webinar on CBD and medical marijuana. Our speaker today is Jennifer Bernstein, who previously was managing editor of High Times magazine and is now CEO of the Women's Cannabis Club and very actively involved in promoting standards for this burgeoning CBD industry. So we're really looking forward to hearing what she has to say. So I'm going to hand the mic over to you now.
Good afternoon, everyone. Thank you, June. Thank you, FSH, for having me host today on CBD and all of the benefits that really everyone can use. CBD is for everyone, and we're in a very exciting time where we have 28 plus states who have legalized cannabis. We have many states that have medical programs in place. And just recently in 2018, the Industrial Farm Bill Act passed. And for the first time in 80 years, hemp became legal. What does that mean? So when we talk about CBD and cannabidiol, basically there's two types of CBD. We can have CBD derived from hemp, and we can have CBD derived from marijuana. There's a lot of questions and a lot of research needed to know about the full efficacy of CBD and THC together. A lot of researchers, a lot of consumers, a lot of doctors believe in something called the Entourage Effect. And this is when CBD is activated by THC. I want to be pretty clear to say that I believe in full plant health and that cannabis should be legal as a medicine, 100% across the board. We need to reschedule it. Currently, it's a class 1 or a schedule 1 drug, meaning that it has no medicinal benefits, and that's absolutely ludicrous and crazy. Because we know firsthand, and we know from select studies that cannabis has a lot of healing benefits and properties. And I hope through our conversation today to shed light on those properties, not only from CBD, but there's tons of cannabinoids, and that's what CBD, is. It's a cannabinoid. So you can have CBD that is derived from hemp. You can have it derived from marijuana. Both fall into the same family as plant, as cannabis, except that hemp is classified as having 0.3% THC or less. So when we are talking about hemp-derived CBD, you're only really truly getting the healing properties of CBD and cannabis. You're not going to be prescribing or aiding in the
Oops, sorry.
With hemp, you have it's classified as 0.3% THC or less. You are just going to be getting pretty much straight CBD, but at least you're getting that 0.3% THC or less, enough to activate these compounds. And with CBD, we have hundreds of cannabinoids in the cannabis plant. They're naturally occurring. We've talked about THC, tetrahydrocannabidiol, which is, gives you those intoxicating benefits. It does give you those feelings of elation. CBD, of course, has more of those healing benefits. What we know about CBDN and THCA, CBDN, excuse me, I'm just going to turn that off. With CBDN, we know that it helps with pain relief. In my own research with CBDN, I applied a topical transdermal patch, and within, I'd say, 30 minutes to an hour of activation, felt pain relief almost instantaneously. So of course, just in this last slide, part of the slide, that with hemp or cannabis, we're really needing to differentiate what is intoxicating, which is basically THC, and CBD, which is more of CBD, basically the healing properties. We can go forward. So there's tons of benefits that are associated with CBD. Off the bat, we know that it relieves anxiety and depression. It helps with mood enhancement. It's a wonderful stress reliever. There are known anti-seizure properties. There are studies that show reduction of epileptic seizures and reduced seizures that come from Dravet syndrome. We know that CBD helps promote better sleep, that it's a known entity for insomnia. People find a lot of relief taking CBD for sleep. We know that there's natural pain and relief when using CBD. There's anti-tumor effects. A lot of people are misled to believe that cannabis is a cure for cancer. We do not have those studies, but we have seen that there is a reduction in the size of tumors. And just off the bat, I had provided a cannabis-derived topical to a friend with breast cancer. She applied the topical for 2 months. She went to her doctor. They saw a reduced size in the tumor, and the doctor couldn't believe what he was seeing. My friend did not feel comfortable sharing that she was using a non-legal substance with her doctor. So it's awful because, we don't have these studies, and she can't even provide, her doctor with, something that's actually really helping and was reversing the tumor. We also know that CBD helps with lowering the risk of diabetes and heart disease, and that comes with just overall stress relief. CBD is for everyone. It's my feeling that CBD is so benign and non-toxic that it's going to be found in everything from our multivitamins to water to essential oils. But currently where we are, there's no regulation. The FDA is currently putting into place what they're hearing from states who have legalized cannabis, and also from hemp farmers now, how they should be regulating CBD. So we're kind of operating in a gray space when speaking about cannabis-derived CBD, but when we mention hemp-derived CBD, of course, this is now legal. In New York City, where I'm living, recently the state put out some of their own regulations saying that you can't use CBD as a food additive. So people who don't want to vape or who want to consume edibles wouldn't be able to, say, buy a chocolate bar at their bodega, which is actually being sold on my corner. You can find a CBD chocolate bar But the problems with going to a bodega or to a market or to a deli is that you don't know what you're getting in the CBD or the CBD oil. So you do want to look to reputable sources for CBD. Off the bat, I can mention easewellness.com. So Ease is a delivery service in California. They created Ease Wellness, which has a menu of different CBDs, whether it's a tincture, and we can talk about this a little bit more, June, if you want to advance to the next slide, please. So on Ease Wellness's menu, you would find that there's a different, number of ways to consume cannabis oil or CBD oil. And for our case right now, we'll talk about, hemp-based CBD oil, since that's what's legal across the board in the United States. But there's different ways to consume CBD: as a capsule, which is of course oral, as edibles, which could be like that chocolate bar or a gummy. There's oral applications, which could come as a tincture, which is probably most people's, I'd say, comfort level in starting to take a new form of medicine. When you have a tincture or a bottle, it comes with a pipette. There's lines for milligram doses or dosage. But again, we're so new to this that there is a huge question surrounding dosage. When I talk to people about consuming CBD, I usually tell them to take a tincture, take a couple drops under their tongue. You want to allow it to pool underneath your tongue and allow for maximum absorption. Try to hold it there for 20 to 30 seconds. People do not like the taste of it. It is very earthy, has a green taste to it. Some CBD could be flavored, say, with a cinnamon or something else. And yes, it helps, but I don't know if medicine is supposed to taste good. I'll leave that up to you guys. But this is a medicine that we're talking about. So we talked a little bit about liquids, vaporizers. They sell CBD cartridges that can be inserted into hardware with the most instantaneous relief. If you're looking for pain relief, I would say vaping is a good way to kind of help with immediate effects, as well as tinctures. But again, with tinctures, there's the absorption rate, how much of it is being absorbed into the bloodstream. When we're talking about topicals and arthritis, or even with muscular dystrophy, I know that there's severe, deterioration of muscles, and if you were to apply topicals to the muscles, you would find relief, I'd say, within, 10 to 20 minutes, up to half an hour, sometimes longer. But what we're trying to get is the maximum amount of CBD and a little bit of THC into the bloodstream as fast as possible. So topicals and tinctures, if you can have a combination, I'm all for consuming as much CBD as possible. There are no known really adverse effects. There are, when I speak with patients, and I'm not a doctor, or people who are, looking to start a CBD regimen, I will point them typically to a friend who is a doctor, Dr. Allison Drayson. She's with the AIM Institute in Seattle, and she's a great resource. And I've been sending people to her because I don't know how CBD will affect other medicines. So I'm just careful. I know the word is contraindictions. Is that right, June? But this is just, basically talking about CBD and how it will affect other medicines. I think we can move forward. So what do we know about CBD and how it interacts with humans and our endocannabinoid system? So as humans, we have an endocannabinoid system, and it's truly fascinating. Plants also have a very similar endocannabinoid system. It's a personal belief that hemp and cannabis was basically made for us. It's all part of our life cycle. We have been consuming THC and CBD for thousands of years in our diet. It's only within the last 80 years that, it was illegal, that we've seen it not a part of our diet. But what we do know about our endocannabinoid system is that we have these receptors found throughout our body, CB1 and CB2, which we'll talk about in the next slide. But we are full of cannabinoid receptors. So we are basically made to consume CBD and THC and allow for these receptors to be open to receive these molecules. And a lot of these receptors are found in our gut. So personally, I suffer from ulcerative colitis, and I have a number of autoimmune issues and digestive issues. I am a patient in New York of the Compassionate Care Act, which allows me to consume THC. I have found great relief with it, and it is because it's targeting possibly these receptors in my gut. So we're comprised of a network of cannabinoid receptors. It helps regulate everything from sleep to appetite, pain, coordination, mood, you name it. And you're welcome to, we'll make sure that you're getting the slides and the presentation after to kind of, read through how our endocannabinoid system works. We can move forward. So I talked a little bit about the CB1 and CB2 receptors, but the CB1 receptors are basically concentrated in our brain and the central nervous system. These CBD1 receptors are more likely to maintain functions like motor activity, pain, help with stress response and memory, whereas the CB2 receptors are found more in the organs that are helping to regulate the immune system, the muscular system, and the cardiovascular system. So of course, with muscular dystrophy, you might want to look for research that includes more of the CB2 receptors. But again, CB1 also, if it helps with motor activity and, if you're seeing the deterioration of muscles and the other, degenerative effects of muscular dystrophy, obviously the more research and studies that we can dig into and support, we'll be able to find out more exactly about what's going on in our bodies. So this is really your field of expertise, but what I have been able to find regarding muscular dystrophy and cannabis is that, you know, studies have shown that compounds such as THC, CBD, CB1 help to reduce chronic pain and inflammation when we're applying topicals. It helps with arthritis. It helps with muscle and pain relief. It improves relaxation, talking about CBD specifically, to help reduce symptoms like muscle stiffness and spasticity. Overall, as your patients are, you know, working through the disease, what I've read is, you know, obviously mood changes and whether it's sleeplessness or depression. Obviously, THC and CBD can help affect mood, and you know, not only is great for the pain relief, but also for overall wellness. There's a ton, and you would think that there wouldn't be, but there is, you know, significant research that does exist. I found a lot of, you know, different sources, NIH studies, different reviews in different journals that, you know, go to support the use of CBD and THC in all of those, in all the symptoms that we've mentioned so far. So we have seen that CBD has been beneficial with MS patients who responded positively about cannabis reducing the spasticity, that it helped lessen pain and spasticity, that this 2012 report in neurotherapeutics noted that, you know, in some of these controlled trials that, again, the symptoms are being reduced. I included some of the links. There needs to be more ongoing research, at least in the states that have legalized cannabis, that we are seeing more ongoing studies. If you want to continue, June, if you go to this Cushley article, which was and is specifically about using CBD as a treatment for muscular dystrophy, what you'll find is they cite a 1977 study where it was trials with mice, and not only did the mice experience less pain, but they actually showed marked improvement having received CBD, and again with the muscle spasticity and just a lot of relief provided by the CBD. Again, Hello MD is a great resource. And so if you are interested in additional online resources, we can, you know, definitely talk a little bit more about them. Again, my expertise is in the cannabis plant, and it's probably better for me to hear from you what you may be hearing from your patients, what your questions are, how you know, CBD can be used in treatments. And you know, I'd be happy to take questions. I don't know if June, you want to help field these questions, but it's probably easier for me to hear questions from you, so I can help guide you to the correct resources.
Well, thank you so much for that overview. Oh, sorry about every time yeah, there we go. So, so we have a Q&A button on the Zoom webinar. If you move your cursor, I think it's it might be at the bottom of the screen or the top of the screen. There's a Q&A. So if you have questions for Jen, please feel free to put them in the Q&A panel, and I'll be reading them off. So at the moment, I'll wait for questions to come in. I had a few of my own. One is, I was interested to hear there is a fair body of research about CBD or THC. I'm not quite sure if those studies that you cited make this distinction, but I've been under the impression that it's generally been difficult to get clinical trials and solid research going on the medicinal properties of CBD and THC. What can you tell us about that, and will that change now that at least the status of CBD from hemp has changed?
Right. Well, so since states have had medical programs surrounding cannabis, I'd say since, well, Berkeley Patient Group started in 1996 with Dennis Perone kind of as a leading activist with using cannabis in the treatment for AIDS. There are most states, before having a legal cannabis program in place, started with a medical cannabis program. So on a state-to-state level, there is the Rohrabacher, memo, which basically allows the states to decide how they want to look at cannabis and deal with cannabis as a legal medicine, as a just even as a recreational entity. So it's basically up to the states to decide. So there are certain universities who have delved into cannabis research. I know about the University of Colorado at Boulder doing some research. There are institutions in California. I mentioned my friend Allison Drayson at the AIM Institute. And as more states become legal, we have seen more research and more studies being done. Of course, with most things, it comes down to funding and money really basically needed. There are plenty of nonprofits that are out there. Project CBD is a great resource also to look into. But it's up to the states to really decide how they want to proceed. And the government is kind of taking a back seat. And with that Rohrabacher amendment and memo, allows the states to decide. So we will see an ongoing and increased number of studies. I was surprised when I found the 1977 study and actually seeing that there has been research, but it's few and far between.
Yeah.
It's my hope that, there will be more funding, and
I think there probably will be, given the intense interest in this. So I have some questions from our audience. There's a question asking, how does the consumer ensure that they are receiving quality CBD?
So this is something that I've been working on for the past year, and I created a company called What Heals All. And What Heals All was created to help take the guesswork out of CBD. The problem with Bed Bath & Beyond, with Walgreens, with CBD being offered everywhere at your bodega, you don't know what you're getting. You don't know if it's effective. How do you know you're getting quality CBD? Well, companies, there's hundreds of companies that are out there, thousands, I would even say now, that are offering hemp-based CBD. Most of, I'd say a small percentage of these companies, at least the quality companies, product test and have lab tested scores and lab analysis on their websites to show that they have tested their CBD. Because what we want to be, careful about is, one, that it's not snake oil, right? How do people know that what's in the bottle is actually in the bottle? And if you're going to some place like Bed Bath & Beyond, how do you know there's actually CBD in it? And Dr. Oz did a study of 13 different brands of CBD, and I think only 3 of them actually even had CBD in it. So how can your clients, your patients know that they're getting quality CBD? One is I would try to work or prescribe, reputable sources of CBD. One company that I like is called Rosebud, and I know Alexis Rosenbaum, the founder, and when she was starting her business, she went out and found the one hemp certified organic farm in the States at the time. And so it made me feel good knowing that her hemp CBD was organic and sourced organically. The problems with CBD and what you want to look out for in CBD oil or any CBD products is that the hemp could be treated with pesticides, how it's grown, how the CBD is distilled, all could play a factor. So when you are looking for a reputable source of CBD, I would look first to the company, see if they are doing third-party lab testing, if they are publishing batch results of the CBD. Most companies will provide the lab tests on their website. Right now, I've been sending people to easewellness.com because at What Heals All, while we're starting to do our own product testing, and that's through creating judges and panels of experts and an advisory board to actually test the product, we hope to give a seal of approval on the products that patients or our expert panels have deemed as efficacious and have an educational model, built around it. What is, very alarming is that there really isn't that much in terms of education. If somebody is just going to a bodega and asking, a head shop or whatever it is for some CBD, they're not going to have the knowledge base. And so it's up to doctors, it's up to us, it's up to even the patients to kind of do the research, and for these companies to provide these overviews about CBD. So in our testing at What Heals All, I want to also see, part of our judging criteria could be how much information does a company's website offer in terms of education. Are they including those lab results? Are they teaching you about the endocannabinoid system? Are they enlightening patients about the medical effects? Now, the problem is that these companies cannot claim any medicinal value or medical effects. You can't write that their product or our product is, known to help with stress relief or anti-inflammation or chronic fatigue. None of that. It's not allowed. It's illegal.
Yes.
So what type of education is being put out by the website? How do you know you're getting quality CBD? Is that lab testing available? Ease Wellness has a menu of CBD products that they have their own standards in testing. Ease Wellness actually took their standards and regulations for creating their own menu of CBD products and supplied it to the FDA, because they knew that the FDA is now struggling with, what should be allowed, how much of, these certain pesticides can be allowed. So it's really up to the companies themselves to self-regulate. And that's
So
where we are right now.
can I ask, does Ease Wellness then serve as a third party reviewer? Do they also chemically test all the products to see what the concentration of, I think with any medicinal thing, that's the number one baseline is, does it contain what it claims to contain? And because otherwise, how can you monitor dosage and, all that? So do they do that?
They do.
Okay.
But another problem across the board is in the dosing itself. There's no clear guidelines on what to take or how much would be effective. And so we're kind of our own guinea pigs in the sense that, we can guide, patients in knowing that take 1 to 2 drops, start with 2 drops, and perhaps start at night. Because if CBD is good for insomnia and you're about to take 2 drops of CBD and you're going to work and now all of a sudden you're groggy and you're tired, I usually typically recommend taking your first dose at night, seeing how you feel. If you wake up groggy, you could have taken too much. So it's kind of that you are working with each individual patient as you would anyway with any type of treatment or pain management plan, and work with the patient to find out what's best for them. And another thing that I want to say about dosage is that each company is different. Each tincture could be different. Rosebud has a 300 milligram bottle. They have a 650 milligram bottle, and they have a 1,000 milligram bottle. And that means that, each pipette dose, or is that what you call when it's in a dropper? So each dropper dose has, the milligram lines on the side, but the recommendation could be take a full dropper, take half a dropper. And how do you know where to start with somebody that's new to CBD? Should you go for the full strength of a 1,000 milligram bottle? Should you start low with a 300 milligram bottle? That's why we need this research out there, because even with dosage, we don't have any clear guidelines of where to start.
So we have someone asking, they were asking about dosage, which you just answered. Said you mentioned a supplier in California that you said is
right. So Rosebud is the company,
okay.
And she works specifically with an organic certified hemp farm. We'll start to see more and more, I think, organic farms kind of, pardon the pun, cropping up. But what we know right now is there's really not even enough hemp CBD to go around. It was only in 2018 that hemp became legal for the first time in 80 years, and there was only, so much hemp being grown in legal cannabis states. So what we're going to see is, a lot of importing of CBD, and I really have to kind of warn you about, CBD oil that is imported from China. We typically like to stay away from Chinese imported hemp oil or CBD oil. I prefer to look at, American sourced hemp farms.
Question, are you familiar with Stanley Brothers Co-op in Colorado? Is that
Yes. So the Stanley Brothers have been doing wonderful work with Charlotte's Web, and Charlotte's Web is a CBD dominant sativa strain, and it was basically being grown for its medical effects, and to help Charlotte, this young girl who had epileptic seizures, I'm pretty sure through Dravet syndrome, and it's close to a miracle case, right? We know that studies have shown that CBD helps with seizures. There's one case that I know of a young child who had 300 seizures, I would say a month. They started her on cannabis oil, and then now she's down to 3 a month, basically. So yes, cannabis, CBD, THC. Again, I believe in whole plant health. So in legal states where you can be prescribing CBD oil, whether it is an 18-to-1 CBD to THC, a 3-to-1, whatever it is, that there is some type of THC to activate the CBD. Again, we want that full plant health. A lot of the CBD oil can only now contain CBD isolate, right? This is an extraction process that is just taking out the CBD, and I believe that you do need at least some of the THC to activate. Yes, look into Charlotte's Web, look into Stanley Brothers. There's another young girl, Nova. I want to say her last. I'm spacing on her last name, but there are, I know in Colorado, there are dispensaries like the Clinic. Ryan Cook, who is the COO, I've been in touch with for a long time, and they've created their own medical program where they have patients who are coming in, whether it's medical tourism, people coming in from Tennessee who can't get CBD or THC in a non-legal state like Tennessee and are going to states like Colorado to consume THC and CBD, and are looking to places like the Clinic, to dispensaries that have knowledgeable bud tenders on hand to help guide patients on their path to wellness.
So I have a couple kind of interrelated questions. There's a question, is hemp and marijuana a different plant? I think we know the answer to that is yes. And then the related question is there a difference between CBD that's derived from hemp versus derived from cannabis or from marijuana, I guess?
Yeah, so just to back up a little bit. So both hemp and marijuana are cannabis sativa, and they both fall into the same family. What separates hemp from marijuana is that hemp is classified as having 0.3% THC or less. It has less of those intoxicating effects that THC is known for. I know more about hemp-derived CBD now just because that's what's legal in New York State, and that's what we're basically able to consume here. So with my Women's Cannabis Club, when we make recommendations on CBD, I can only make a recommendation on hemp-derived CBD. Would I prefer to be able to make a recommendation on marijuana-derived CBD, yes, because that does give the patient a greater chance at healing, having, more of the active THC compound.
So there's a question here, can use of CBD cause a positive drug test? Because some employers require drug testing in certain professions.
Correct. So yes, I mean, they definitely can, but with the hemp-derived CBD, if it truly is hemp-derived, then it won't show up on a drug test. When you're consuming, obviously, cannabis-derived, marijuana-derived CBD, yes, that will definitely show up on a drug test.
So tests only look at THC. They don't mix it up with cannabidiol. They're not picking up like
No, I mean, drug tests are really looking for THC.
Okay. Is there such a thing as taking too much CBD? Is there potential for overdose?
So right now there are no known, you know, overdosage or really horrible ill effects with CBD. I kind of alluded to, if you take too much, you're just going to feel really groggy and sluggish. You'll have that kind of foggy feeling. So when you're making a recommendation, I tend to skew on, you know, go a little bit light and see how you feel in the morning. Take 1 to 2 drops, and that's why I also recommend taking it at night. So when you wake up in the morning, you'll have a restful night. But then also, if it's too much, you'll know pretty much right away. I don't think you can overdose on CBD. I haven't read anything. I haven't seen any studies alluding to it. It's just really in that, that sleepy state. Again, this is a non-toxic plant. Had we found it today in the Amazon, which is unfortunately burning, that we would be lauding CBD and this plant as a miracle plant, as a miracle drug. There's so many uses, and it's so effective in its pain relief. And unfortunately we can't make the claims, but hopefully pretty soon we should be able to.
So here's a question from a patient who says she uses, I'm not sure if it's marijuana or I use the plant. I love the overall effect. I'm concerned about weakness in my legs. It relaxes me, but could it be too much and lead to, I guess the falling is a big concern.
We've only seen, healing benefits with CBD. So we haven't really seen, like a deterioration or, it does nothing but like boost and have positive effects. I wouldn't fear falling unless that's something, a side effect really of the disease.
Well, it is an increased risk if you have the disease. So if you get overly relaxed, or if in any way your balance, I don't know, there might be.
Yeah, well, I mean, again, with those, those groggy feelings, those, feeling sleepy, and it does aid so much in relaxation. So I could probably say, not having really dealt with patients with, muscular dystrophy or deteriorating muscles, that, there could be a slight chance at, feeling so relaxed that there could be a chance for a fall.
Question, can you build up tolerance if you keep using CBD? So would you have to increase your dosage over time?
I would say yes. I have a friend who is the president of the FSHD Research Foundation, and her daughter, who has, also a rare, debilitating, degenerative disease, um, over time, she's had to work on Josie's dosage, right? So Josie has been receiving cannabis oil and CBD oil. Oh gosh, I would say maybe 5 to 7 years now, and I'd be happy to put you in touch with Nicole Johnson, who is the president of FSHD, and she's had to either scale back Josie's dosage, or right now she's actually increased the dosage. So over time, yes, you do build up a tolerance. And so I would then look at, either a stronger dosage or consuming more.
So here's a question about, you say you think that CBD works best in combination with THC. Do you have any, or is there any research on optimal ratios, I guess, of that CBD, THC?
I'm sorry, I don't have that information right at my fingertips. But, definitely with my own use, I have taken everything from an 18-to-1 to a 4-to-1, and the 18-to-1 CBD to THC was far more effective for me. My friend's mother, who started taking a capsule of the 18-to-1, within a month of taking the 18-to-1, all of a sudden, like, she didn't feel the arthritic pain in her knees. She felt overall joint health. The inflammation that she had in her body was slowly going away. So it's really about self-exploration and working with your patients or on yourself to find what's best for you. Again, as much THC to CBD that you can allow for yourself. Again, but with THC, you're going to get more of these intoxicating effects, and most of America wants the healing effects of CBD and not the intoxicating effects. And this is in the day to day, right? So we want to wake up and be able to take a CBD capsule and go about our day and be able to function and feel good, but also do that not feeling high. Now, don't get me wrong, I worked at High Times for 7.5 years, and I am a huge proponent of feeling the intoxicating effects and the recreational use of THC. My husband would tell you that I am a better person, a better friend, a better wife when I am consuming THC and CBD. It helps with my mood. It makes me more relaxed. I just, overall general health, I just feel better. But even at High Times, I couldn't do my job as a managing editor, having to put out a magazine, a 140-page magazine every 3 weeks with those intoxicating effects of THC. Now, I'm different. Everybody is different. Every body is different. And, a lot of people talk to me about, what's the future of CBD? What's the future of cannabis? I think in the future, we're going to have, just like there's the Myers-Briggs personality indicator test, we're going to have a weed personality test. We're going to be able to map out a little bit more closely, whether it's the compounds, whether it's, I should skew more THC, or if I should skew more to CBD or CBDN. And hopefully, as there are more studies and there is more research and we are testing on ourselves more, that we will find the optimum dosage for ourselves. But again, everybody and every body is different.
That's a very good point. We're almost out of time. We still have a bunch of questions, so maybe we can try to race through a few of them. Someone wants to know, what is the monthly treatment cost? Because they're assuming that medical insurance would not cover this. And I think it's hard to say, I guess, what it's been used for.
And I met with somebody from Empire Health in New York City just recently, and started talking about what would it take for would it take a federally legal substance to be covered by insurance. So it's something that I'm personally interested in. But yes, cost is an issue. You'll see CBD tinctures based on how much CBD is actually in it, whether it's a 300 milligram bottle to a 1,000 milligram bottle. I'm just going to use Rosebud as an example. You could go on Rosebud's site and see the cost. I mean, it could be anywhere between $65 for a bottle on up to $150. And I would probably allow somewhere between, $150 will cover a tincture, possibly a topical. So any price range between like $150 to $200, you could probably be safe to say would be, moderate for a month's dose.
Yeah. Okay. Thank you. How about methods by which the oil is extracted from a plant? Is that a factor in judging the quality of a product?
So I alluded a little bit about, CBD as an isolate or the distillate. I, again, believe in whole plant health and the full spectrum of cannabinoids. So I would definitely try to look for, and this is very kind of buzzwordy now, full spectrum. So again, you have to, be aware that yes, companies are preying on consumers who are, looking for these things, but full spectrum and, whole plant is definitely preferred.
Do you need to take these products regularly to feel their effects, or can you use them sporadically as needed?
It's my recommendation, as with any medicine, that you would take it at a minimum for 2 weeks to a month to really feel the full effects. A lot of people will try a tincture for a day, 3 days, 5 days, really dislike the taste, say, you know what, this isn't for me, and give up on it. This is a medicine. You can't just stop taking a medicine. You really have to stick with it to feel the efficacy.
I think on the other hand, I would say from my personal experience, topical CBD was instantly effective in alleviating like a muscle pain. And that seems like a use where, you might use it as needed when you're experiencing.
Definitely. It's all about, so obviously topicals enter the bloodstream transdermally. If you're rubbing it on the muscles, there's a lot of, offerings out there for CBD massages that, everybody should really be going for, because it's so helpful. But yes, topicals are a great, entry level way into exploring CBD. That is effective.
Oh,
And I'm glad that you've found, that it helps
I
you.
wasn't even expecting it to be effective. And it was kind of, I noticed after this massage that I had, I said, oh my gosh, my back pain is completely gone.
No.
I was just, so it was interesting.
Yeah, and you know what? I don't use CBD topicals daily, but you're right. Now that I think about it, I'll have my husband massage my feet, or I had a stiff neck the other day, and I applied. It's called CBD Relief, and it's a roll-on, and it's super easy to use. It's non-greasy. It's a roll-on, so application is easy. And I used it on my neck with some gentle stretching. Also included in this CBD roll-on is arnica. And you'll find that, CBD pairs well with other plants or oils, whether it's lavender, for, sleep, if it's peppermint oil for, a more awake or alert state, that helps.
Yeah. I did want to mention, because you had talked about vaping as one method of taking CBD, and it seems like, given the recent health concerns, very serious health concerns about vaping products, and I guess this goes into the unregulated nature of this industry, and also people possibly using bootleg products or homemade products. Do you feel people should be? What are the cautions around using vaping products?
So, just like any other, product that hasn't been tested, or we don't have the research on vaping or topicals or tincture. I mean, it really is, hard to say one way or the other without the research. But vaping is so new. I started a vape pen review in 2015 and tested, vape pens for high times, and would name these, vapes the number one vape pen. And I'm still alive, which is the good news. But what I would say is, when you go to Ease Wellness and you see that they're offering vape cartridges, you do know that they at least are being tested, and that the ingredients are of quality. Now, the I guess the recent news, which is that yes, this is an unregulated part of the industry, that there are, black market and, untested products out there. It is very much a buyer beware, but on the same hand, I feel that if you are going to a trusted resource, that vaping's benefits should outweigh the negative health benefits, and that is, or detriments. And that's my own personal view. There are plenty of other ways to consume CBD. So if it is a concern, I would explore the other options first.
Great. Well, thank you so much for that. We ran a little bit over time, but I really appreciate your being here today.
Happy to help. And June, if you want to share the presentation with your group, or if anybody's interested in it, if you want to make it available, it's totally for your use. Definitely look into those studies. I, would recommend easewellness.com as a great kind of, starting point to explore some of the products and the offerings that are out there. I would, also continue to do your own self exploration, right? This is a benign plant, and there are thousands of uses that we're only beginning to know and understand. And I would welcome any questions that you have. in the future, my contact information is on the last slide.
We'll share that. Okay, thank you so much. Thank you, everybody, and have a great rest of your day.
Okay, thanks.